Ladies and gentlemen, welcome back to another video on the channel. Today we will be going through Anatomy of the Skull Part 4, which is the last and final part of the Anatomy of the Skull, where we are describing the bony structure of the skull in complete detail. So, in this part, it's a very easy part. We're just tying up loose ends. We finished all the difficult stuff. Now we're just going to go through the mandible and the orbits. Both are very easy bones, very simple structures, which are not that hard to go through. So we're going to go through them really quickly. Starting off with the mandible. The mandible is a U-shaped bone, and for those of you that don't know, it's also known as your jaw. You use it a lot for talking, eating, other things, and it is very crucial and important if you like the way you look. So, we're gonna start off from the anterior-most part right here, this area. In this region right here, we have the mandibular symphysis, which is just the region where both halves of the mandible fuse during development and they form some sort of artifact left or some presence left. That's the mandibular symphysis. And moving down, again, gonna mention it. We mentioned it before. We're gonna go through it again. The mental protuberance. What is the mental protuberance? Mental protuberance is the part that makes your chin. Yes, correct. That region or that projection is what creates your chin. So if you do not like your chin, that's the person you don't like. That region right there, the mental protuberance. If you have a weak one, you have a weak one. There's nothing you can do about it. Moving on. So the things that we didn't talk about last time when we talked about the mandible, the mental foramen is the region, or the, well, it's a foramen, so it's a hole clearly where the mental nerve and vessels pass. These are very necessary for the sensations around the chin, to be able to, it all goes back to cutaneous sensation, where touching and what you feel, it's a whole process which we will describe when we go through the nervous system. Now, the mandible also contains the alveolar processes, which are your teeth, and there is the dedicated space for the alveolar processes. I'm gonna shift to the right here to the lateral view, because that is where all the juicy stuff is when it comes to the mandible. It is composed of the body and the angle, the ramus, and the condylar and coronoid processes. Now, the body is this horizontal part right here. This big bulk of it, that's called the body. That's known as the body. Now, if you know any math at all, or if you have just passed third grade math, you know that this is an angle. That's the, okay, I don't think third, like fifth grade. That's the angle of the mandible. The angle of the mandible is the region where it deflects from going straight to going up. That's an angle. Then, as we go up with the angle of the mandible, we keep going up from this region, we will have the posterior border of the ramus. So logically, if we have reached the posterior border of the ramus, that must logically mean this is the ramus. I know, right? Really difficult. So, recap. Body, angle, ramus, posterior border of the ramus, and at the very top part, most laterally, most posteriorly. So the most posterior region of the mandible from the ramus is the condyloid process, also known as the condylar process. Different books, different names. This condylar process attaches right here to the temporal bone, forming the temporomandibular joint, also known as the TMJ. TMJ is a very important joint. It is the joint where sometimes you can hear a crack if you talk a lot, or if you move in a certain way, move your jaw in a very certain way, you might hear a pop. That pop is the TMJ. The pop can be painful sometimes. That means you must have moved it too much or strained some of the muscles, or it can be just like a normal sound and that's it. That's totally normal, totally fine. Now, let's talk about the two parts here, the two things that are going in two very different directions. That's the condylar process, and this would be the coronoid process. Now, the coronoid process is just another region of the jaw. As you can see, this does not attach to anything. The coronoid process moves. It is open, because when you move your mouth, it also moves with you, know? So it is just the coronoid process and the condylar process, and between the coronoid and condylar process, we have the mandibular notch. These are all just the landmarks of the mandible. If I am to describe each and every use of the necessity for each landmark, trust me, we would not be ending this video anytime soon. So I'm just gonna go through the bony landmarks, and when the time is right, we'll go through their attachments, the muscles, and all of that. I'll give you a quick recap. Anyway, yeah. So I'm pretty sure that is about it about the mandible. There isn't really much to describe. It's really not that hard to get. So now we'll be moving on to the second part, the more fun part. I personally like the orbit a lot, the bony structure of the orbit. So let's just do that because we're done with the mandible. Going down, let me just rotate right down. Okay, so orbits. You have two of them, and I'm not talking about the orbit of the Earth. Please focus with me. The orbit here is a place where your eyes go, where they already are. They don't go anywhere. They're already there. They is created from a lot of bones, if we're going to be honest here, including the frontal bone, the sphenoid bone, the zygomatic bone, the maxillary bone, the palatine bone, the lacrimal bone, and the ethmoid bone. So pretty much like you want to talk, say, let's say 80% of the bones of your face, all some way, directly or indirectly, form or help in the formation of the orbit. Alright, so if we were to do this from right from the, I'm sorry, I'm a terrible artist, and go like right this, that's almost perfect. And if we are to go through this and we are to start here, this is the frontal bone, correct? We talked about this. It is created, the roof is created from the frontal bone fully, or not fully, let's just say mostly 90% is from the frontal bone, with a little bit of the lesser wing of the sphenoid bone. Moving to the left, to the lateral wall of the skull, we have the right zygomatic bone. Depends, right or left, but generally we have the zygomatic bone and the greater wing of the sphenoid. These both contribute to the lateral wall of the orbit. Now, if we are we're done with the lateral wall. If we are to move and look inside the orbit to see the medial wall, the medial wall is composed by a bunch of bones. It is the most, let's say, complex, and it is made up of mostly the right lacrimal bone or left lacrimal, depends on which orbit you're looking through, the ethmoid bone, the lacrimal bone, the maxillary bone, and the lesser wing of the sphenoid. If you can see again, there's that yellow, that's the lesser wing of the sphenoid. Would you look at that? And a little mnemonic to help you guys remember the medial wall, only for the medial wall. My little eye sits in orbit. Now, my would be the maxillary bone, little is the lacrimal, eye is ethmoid, and sits is the sphenoid bone. You have to remember that's the lesser wing of the sphenoid bone, and in orbit is just to remember, for you to remember that it's in the orbit. You talk about the orbit. Very logical, very simple, very easy. Now, going down to the floor, which is the final part of the orbit itself, we have the maxillary bone. Logically, it's the largest bone from the bottom before your mandible, so logically it's going to make up the floor. Maxillary bone, the palatine bone. Let me see if I can locate it. No, 1 second. Yeah, the palatine bone, the zygomatic bone. However, not the full zygomatic bone, because we said the zygomatic bone forms the lateral wall. It is the orbital plate of the zygomatic bone that forms the floor, and that is it for the floor. And just to remember the little holes and notches that are important for the eye, we have the optical canal or optic foramen, where the optic nerve passes through. We have the, okay, these are not labeled, so I'm going to show them to you. We have the superior orbital fissure, which is, oh, right, yeah, 1 second. Superior orbital fissure, which we talked about, which is right here, this over here, this. I like the whole drawing aspect now. The superior orbital fissure and the inferior orbital fissure. Both of those fissures are present over here, superior and inferior. And we also have one more thing that is important, which, my good friends, is, 1 second, this, the infraorbital foramen. What is the infraorbital foramen for? You guessed it, infraorbital arteries, nerves, and veins. That's it. Just a lot of the foramens, if they are not like unique and specific, they're not divas like the foramen rotundum or ovale. It's usually the same name of the arteries or veins. So infraorbital would be infraorbital vein, artery, and nerve. Not too difficult, not very simple. So yeah, that's pretty much it for the full of the orbit. Oh, I just want to mention one last thing about the orbit, because as a student, when I was reading this, when I first took this in anatomy, the aspect of the orbit, the most thing that confused me the most was this sphenoid bone. So just keep it simple, don't overcomplicate yourself. Just remember that the greater wing of the sphenoid is only for the lateral wall, and medial and the roof both take the lesser wing. So just don't overcomplicate, don't look at so many images, do not uh, make it harder for yourself. It's not that hard, it is not that difficult. Just focus, clear your mind, imagine it one by one, piece by piece. Remember, the lesser wing is, even though it is lesser, it is more in the orbit than the greater wing only contributes to the lateral wall, lesser contributes to the roof and the medial wall. And yeah, that's pretty much it. I hope you guys do not find this very difficult at all. I hope that we were able to help you. And if you need anything else, any specific bone to be described in full intense detail, please let me know in the comments. I would gladly love to do that. And yeah, see you guys next time. Stay safe.